African Population and Health Research Center has now been independent for 15 years. To mark the occasion, there was a day of celebration and introspection. It was also a day for planning the future.
To have survived 15 years and to be seen as doing excellent work that is globally relevant is really a cause for celebration. We started APHRC with the notion of whether Africans can actually think and do research. We've supported the training of at least 370 doctoral students across sub-Saharan Africa, publishing their own research as primary and principal authors, but more importantly, able to draw in research grants to support their work.
It's not just about the research that APHRC does, and it's not just about the amazing researchers that are being trained and going off into having spectacular research careers. But I can imagine a day 15 years from now where we see ministers of health and ministers of education with a strong evidence-based background who are not just consuming research, not just producing research, but actually in a position to allocate resources based on that research.
APHRC upgraded 3 health facilities where we have Provide International was upgraded and equipped. Tumaini Clinic was upgraded through this program and equipped.
I have seen improved health matters. First, the maternal health, low death or no death, because it have boosted this with improving the community hospitals which are in the area.
We had very few schools around the slums, but currently we have a number of private schools coming up, and children in those areas, they get access to education.
I remember when we conducted the Nairobi cross-sectional slum survey in 2012, I was working on that data. And when we compared it and we went to the slums and looked at what happened in 2000 versus 2012, I could tell that it is important for us to be there.
Governments listen, but they listen more to the evidence, not to us as an institution. It's the quality of the evidence we bring in, the rigor of that evidence, and the validity of that evidence that they listen to, and which is so compelling in many different instances that you cannot walk away from it and not feel you really need to do something about this evidence.
The great news is that African governments, African donors themselves are now investing in this, and having APHRC here provides an excellent institution to take this agenda forward. So I'm really optimistic for the future.
We want to see APHRC as a critical partner in Africa's development in terms of creating the knowledge that can move Africa forward and driving the development discourse on Africa.